Hello again. In this video, I'd like to convince you that your opinion really matters. A key skill to being a patient advisor is to share your opinions and your insights with the research team. But for some people, they ask me, I don't know anything about research or about medicine. What can I contribute? I want to convince you that your unique opinion and insight really matters here, and to encourage you to share your opinions and insights with the research team. So when we're doing research, doctors know about medicine, pharmacists know about drugs, biostatisticians know about study designs, but who knows about the day-to-day reality of living with a disease or a condition? Who knows what it's like to be a patient? And who decides when a treatment has been successful? Only patients know that. And those are the insights and opinions that you can share with the research team when you're a patient advisor. So let me tell you a story to illustrate. Back a few years ago, I was doing a series of interviews with patients that had had a surgery called carotid endarterectomy. So as you recall from week 1, we have these carotid arteries that take blood from our heart up into our brain. And sometimes, in some patients, those blood vessels get clogged and narrow. A carotid endarterectomy is a basic surgery where the surgeon opens up the neck, opens up the carotid artery, takes out that blockage, and then closes everything back up. So as part of these interviews, I was talking with patients who'd recently had a carotid endarterectomy, and I asked them, what was the biggest problem after your surgery? And me, I was thinking about medicine. I was thinking about surgery. I was expecting answers like, I was in a lot of pain, or I'm embarrassed that I have this big scar now on my neck. Or even something like the hospital food tasted really bad. That's what I was expecting. But do you know what people told me? The biggest problem they had was driving. To a person, their surgeons had told them after their surgery they weren't allowed to drive for 6 weeks. Now imagine if you couldn't drive for 6 weeks. What do you think that would be like? Your family would have to come and take care of you. They would have to drive you to your appointments. They would even have to go get you groceries. It would be a big burden, a big effect on your life. So the researchers had no idea that driving was the biggest problem following carotid endarterectomy. This is the kind of insight that you, and only you, the patient advisor, can bring to the research team. You're the person who thinks about these real-life problems, and you're the person who experiences these kind of challenges in your day-to-day life. Doctors have expertise in medicine, and they're thinking about medical questions. Biostatisticians have expertise in research design. But you, and only you, as the patient advisor, have expertise on what it's really like to be a patient and participate in research. And that opinion matters. That opinion matters a lot, because that unique perspective is what you as the patient advisor will bring to the research team. And your opinion is what will help make research more patient-centric, more important, and ultimately more meaningful and able to help improve people's care. Thank you.